Okay, well, hi everyone, and thank you so much for joining us today. Well, I'm Sherry Singer, president of Singer Communications, and we help associations solve their PR, marketing, and communication challenges. I'm the founder of Association Xchange, AXC, and the chair of ASE's Research Foundation's development committees. Just a couple of housekeeping announcements before we start with our speaker. If you have questions, please type them into the chat box, and we will do our best to get your question answered. I'm very excited to bring you today's very special AXC about how menopause affects associations. About 75% of the association workforce is women. So there's a good chance that somebody that you're encountering today is going through the change. It could be your boss, a coworker, a member, or a leader. So today we're parting from our usual topics on membership or social media to talk about how menopause affects you as part of our association community. And I also wanted to mention it's a very timely topic because the queen of the small screen, Oprah, is actually hosting a special on menopause on Sunday night on ABC. So if you're interested in this topic and getting additional information, feel free to tune into ABC for that Oprah special. So without further ado, I'll turn it over to our monthly program coordinator, Christine, who will introduce our speaker.
Hi, everyone. I read an interesting statistic that by 2025, roughly 1.1 billion women will be postmenopausal. And that is a massive share of the workforce and of the population in general, right? That's a huge chunk of our moms, our sisters, our coworkers, ourselves. But menopause is so often overlooked. And that's why I'm absolutely thrilled. We have this month's speaker, Dr. Stephanie Faubion, who is a true leader in women's health. I could spend the next 45 minutes just talking about her credentials and achievements. I will not do that, but just a few. She's director of the Mayo Clinic Center for Women's Health. She is the medical director of the Menopause Society. She is professor and chair of medicine at the Mayo Clinic in Jacksonville. And apparently, because earning an MD wasn't challenge enough for you, you went ahead and got your MBA as well, Dr. Faubion. And when it comes to menopause, she very literally wrote the book. She's an author of The New Rules of Menopause, a Mayo Clinic guide to perimenopause and beyond. She's a leading researcher. She's the editor of the journal Menopause. So we are incredibly fortunate that she made the time and is with us today to share her expertise and help all of us understand this issue a bit better. So please join me in welcoming Dr. Stephanie Faubion.
Hi there. Thanks so much for that warm welcome. And I'm really excited to talk to your group today. I'm happy to be here. And I am also a clinician. I practice what I preach. So I see women in menopause on a regular basis. So I'm going to figure out screen sharing right now. Okay. And I'm sharing right. Okay. And we will get the talk up. Okay, let me know if you can't see because I can't see you right now. All right, so we're going to start with menopause in the workplace. I have nothing to disclose here. So our learning objectives today, we're going to talk about the potential impact of menopause symptoms in the workplace, and then more importantly, probably discuss opportunities for implementation of workplace policies to accommodate women with menopause symptoms. And I'll tell you a bit about the Menopause Society's Making Menopause Work initiative. So let's level set a little bit here with some background. Menopause is not just a niche thing. And in fact, I went and spoke to an investment group recently, and they said, they prefaced the whole talk with, we realize this is a niche topic. And I said, this is not a niche topic. This is 51% of the global population that goes through this. It is a universal experience for women. And it's important to note that women actually do drive the global economy and are a vital part of the global workforce. So this is not inconsequential. We also know that menopause symptoms are very common, and more recently, and this is a publication just in 2021, we came to find out that menopause symptoms start happening well before the last menstrual cycle occurs. They start happening even before women have started to miss periods, so even before a 7-day difference in the cycle length month to month. We also know that about 75% of women are going to have bothersome hot flashes and night sweats. There are some racial and ethnic differences. We know women of color tend to experience an earlier onset of symptoms and a more prolonged duration of symptoms. For example, African American women have vasomotor symptoms or hot flashes and night sweats for a mean of 10 years. We also know that hormone therapy prescribing rates are very, very low right now. And my team and I are about to publish some new data that suggests that the prescribing rate in the United States is less than 2%. So it's about 1.7% of US women are currently receiving hormone therapy, which is quite low. About 25 years ago, it was in the range of a quarter of women were receiving menopausal hormone therapy. So let's shift gears and talk about women in the workplace now. This is 2024 McKinsey report, and this talks about how women are represented in different positions throughout a company and the leadership roles. And this is comparing 2015 to 2024. So each of these levels, you're going to see the left-hand side of the bar is 2015, the right-hand side is 2024. So you're going to see that as women enter the workforce, we represent almost 50% of the workforce. But as we get up through leadership levels, we progressively decline in the percentage of women of the total. Now, while we've made some gains in terms of the C-suite, we are nowhere near representing 50% of the leadership roles. This breaks it down a little bit more, and the key point here is that women remain underrepresented at every stage of the corporate pipeline, regardless of race and ethnicity. So if you look on the left-hand side, you see about 48% of women, that's white women and women of color together, are at the entry level, but that declines to about 29% at the C-suite level, and African American women are the least represented group in that C-suite level. What is it going to take to achieve gender parity? It's going to take about 50 more years in the workplace at the current rate for everyone, including women of color, to reach parity, which is a little bit on the depressing side. All right, let's go back to impact of menopause symptoms at work. We know that menopause symptoms can impact women at work, and it's not just about the hot flashes and the night sweats. That's what we all think of when we think about menopause. It's also the sleep disturbances. When women aren't sleeping adequately, they have a hard time performing up to their maximum the next day. They report brain fog a lot, and women in my office are frequently complaining that they have trouble thinking, they have trouble concentrating, mood changes. I will tell you a little bit later that mood changes are one of the drivers for poor work performance or adverse work outcomes like missing work. Women specifically tell us that they're missing work, especially due to the mood symptoms. And then even in our study that we published from Mayo Clinic a couple of years ago now, genitourinary symptoms, urinary leakage, vaginal dryness, those symptoms even drive adverse work outcomes like missing work, believe it or not. All right, so we know that menopause symptoms have been linked with lower hourly productivity, lower annual productivity, lower work performance in general, an increased likelihood of exiting employment or reducing hours, increased risk of unemployment. And this study that I'm quoting right here, the 2 billion lost in productivity in the US, that was due to new onset sleep symptoms specifically. And an interesting study that just came out like a year and a half ago now, the occupation type and the physical requirements. So in other words, physical labor, you're not more likely to have a problem with your job if it's physical labor versus a white collar job. It's the same. So occupational type and physical requirements did not influence these results at all. Now, the relationship between work and menopause symptoms may be both ways. It may be bidirectional. We know that psychosocial and physical aspects of the work environment may also influence a woman's experience of menopause. For example, if she's under work stress or there's unpredictable, long or inflexible work hours, that influences how she perceives her experience of menopause. So we know that this relationship between the workplace and menopause symptoms works both ways. In fact, they looked at this recently, a big study, a systematic review, 12 different studies in this one review looked at over 15,000 menopausal women, and menopausal symptoms and environmental factors predicted poor quality of life in the workplace. And they looked at things like working in confined, crowded spaces, high levels of noise, poor workstation design, unstable work patterns like constantly being interrupted. I know none of us have that ever, right? Insufficient restroom facilities. So all of these things impacted a woman's experience of menopause. This is super interesting. So we also know that shift work has the potential to disrupt our circadian rhythms. It alters our sleep-wake cycle. It alters estrogen and progesterone secretion patterns in the brain, and it's linked with irregular menstrual cycles. And we even know that women who work night shifts in particular may have an earlier onset of menopause compared to those women who worked in day shifts. So it even can influence the timing of onset of menopause. So work and menopause experience are intricately linked. We also know that there's an economic impact to all of this. So there are increased healthcare expenditures, and Phil Sorrell did some nice work a couple of years ago. I took the number he got a few years ago and put it into today's dollars. And we know menopausal women, or those women in right in early menopause, cost the medical system more. They cost about $1,300 per year more than anybody else. Why? Because they're having symptoms like hot flashes and night sweats, they might go to a gynecologist. They're having palpitations, they might end up in a cardiologist's office. They're having urinary leakage, they might end up in the urologist's office. They're having mood issues, that might end up in the psychiatrist's office. And nobody, meanwhile, is putting all of this together, saying all of this is a syndrome of menopause. So it ends up costing the healthcare system and employers more money. I also told you about lost work productivity. So it's costing the system and society in that way. It's costing employers and companies, and it's costing women, because we are starting to find out that women are not putting their names in for the promotion. They're turning down advancement opportunities. They're taking lateral positions. They may even exit the workforce early, which is potentially putting them at risk of financial insecurity later. So this is not a small impact, and impacts everyone at every level. So this was our study that we published, it was 23, it was 2 years ago now. This was the hormones and experiences of aging study, and we looked at 4,400 women aged 45 to 60. 13% of them said they were experiencing at least one adverse work outcome, and that included everything from missing days of work to missing hours of work, etc. 11% of them said they had missed one or more days of work in the last year, specifically due to menopause symptoms. And we outlined what those menopause symptoms were. The mean number of days missed per year was shocking to me. It was 3. These women told us they were missing a mean of 3 days of work a year related specifically to menopause symptoms. The interesting part of it is we looked at it according to domains. So the domains are the somatic domain, which is hot flashes, night sweats, sleep disturbance. There's the psychological symptom domain, which is all the mood stuff, the anxiety, the irritability, the depressed mood, or the genitourinary, the vaginal dryness, the urinary leakage, etc. It was really the psychological symptom domain that was driving the missed work. So the women in the highest quartile of symptoms versus the lowest quartile of symptoms for the psychological symptom domain, they were 21 times more likely to miss work. So really the mood issues can be quite problematic during menopause. We decided to put a number on that. And we ended up using US Census Bureau data and say, okay, what if women between the ages of 45 and 60 were actually missing this much work across the United States, added it up, and that comes to $1.8 billion annually, just related to the lost work productivity. And we didn't even try to calculate the lost work hours. We just talked about lost days of work. We also didn't really factor in the medical costs, but if you add those into how much it's costing our medical healthcare system, it comes to a total between the indirect and the direct of $26 billion annually. This is, again, is not inconsequential. All right, so I'm going to shift gears a little bit here, and we're going to talk about consideration for workplace policies. So what can employers really do about this? The Menopause Society has taken this on in the last year. And first of all, let me get back to, do employers want it or employees want it? Yes, they want it. So a Mercer report published in 23 said that a full 42% of their employees said they wanted menopause support at work. A few 17% said their employer actually provided it. And among those organizations with over 500 employees, 15% offered menopause benefits or planned to do so. So that tells me that not all 15% of those actually did implement something in 24, and we don't have follow-up numbers to see who actually did. But this includes things like access to specialists and medical coverage for their symptoms. All right, so a few healthcare organizations, including the Menopause Society, European Menopause and Andropause Society, Menopause Works Here, which is from the Menopause Foundation of Canada, and the Society for Women's Health Research have all put out some guides in the last year, or last 2 years, I'll say, about resources, what women should be doing, what workplaces should be doing to assist women in this time. So this is starting to be looked at on a more global level. The Menopause Society, which is a US organization, and now actually beyond, we've been in North America, but we're now extending beyond that, came up with a consensus recommendation on menopause in the workplace that was published last August. I can certainly get a link to that for you guys if you would like to see it. So we came up with this. This is what is in the consensus recommendation. We said, what should employers do? And keep in mind, when we had this panel, we had patient group representatives, we had physicians, we had researchers, we also had legal representation, so that we weren't saying things that employee health and law can't allow or won't allow. So what we came upon is evaluate existing policies and healthcare plans. Just from my own institution, I did the same here. I said, what are our policies for menopause? Where do they exist? Well, of course, there was no mention of menopause anywhere in the workplace policy. So we added some language about that, because one of the things that was very clear is that women don't know where to look, even within their own employers. They don't know where to look for, does this include me? Do my healthcare benefits include menopause? We also suggest providing education and training to managers and supervisors on menopause, just even how to talk about it with employees. Should I talk about it? Not all women are going to want to disclose that they're in the middle of menopause. That's fine. They shouldn't have to disclose. But at the same time, managers and supervisors should be competent in speaking about it without it being a ha ha ha, are you sweating today? Are you in menopause? It really should be with a lack of judgment, with compassion, with cultural sensitivity, etc. Employers should ensure that all employees are aware of the policies, offerings, and healthcare coverage. Again, sometimes you don't know where to look for your own benefits. And then it seems like it would make sense, but it's not universal. Provide access to restrooms, sanitary products, cold water. Consider flexibility in terms of breaks and scheduling. Dress code policy. Do we all need to be in a heavy uniform? Can there be some flexibility there? One of the ways women cope with some hot flashes is dressing in layers. Can I take off my jacket? Sometimes that's off on all day. Options for hybrid work or remote work, and control of a thermostat in their workplace. What should employees know or do? So employees should know that they can seek information on menopause to help navigate their experiences. There are some good places to do that, but what we're suggesting in our workplace initiative is actually supplying employers with these workplace toolkit that employers can give their employees that will help them, has evidence-based education in it. Contact Human Resources or Occupational Health Department to identify workplace policies and resources available, understanding that not all are menopause specific. So again, we don't have to reinvent the wheel here. If many women are having mental health issues during their menopause experience, We don't have to create a mental health policy just for menopause. We can use existing policies, and most corporations already have something in place. Consider starting or joining an employee resource group. Understand the laws. They differ state by state, and the protections may be different, but understand what protections are available that are applicable to insurance coverage and access to care. And just a side note here, occupational health clinicians are often, most clinicians, not just occupational health, most receive zero education on menopause. And even most gynecologists in this country get at most 1 to 2 hours of education on menopause during their training. So occupational health may not have all the answers for women, but they should know where to refer women for help. What should occupational health professionals do? So here we go. They should be routinely asking about menopause symptoms and asking women about the perceived effect on their quality of life, including work performance. I can guarantee you this is not happening in current day state. They should also have a working knowledge of menopause, the impact of menopause symptoms on work, and of the workplace on menopause, knowing that this is a bidirectional relationship, and the various therapeutic options that are available for management of symptoms. Most of them don't have that training or background right now, so there's going to be some scale up in terms of knowledge, but they should know at least where to refer women for evidence-based care. And this is our new Menopause at Work designation program. This hopefully will be launching in the summer. It's called Making Menopause Work, a program of the Menopause Society. Right now, we have free resources online that are already available to everyone. So this is on menopause.org. There's a free employer guide with tools like talking points for building momentum on menopause in the workplace, a fact sheet on supporting employees, an FAQ sheet, a conversation guide, a self-assessment and planning tool. So there's a lot here for employers to get started with that is already free on menopause.org. But the actual designation program is going to launch later this summer. So here's an example of the free resources that are available online, Making Menopause Work, an employer guide. We worked very hard to make this user-friendly language, not medical speak, to where it's very accessible. So here's an example of what's in the employer guide: improving workplace environments, dress requirements. We get pretty specific here, like actions that employers can actually take: better ventilation, fans, windows, temperature control, access to ice and cold water, a room to change in, consider altering the dress code when possible, etc. All right, so here's the consumer fact sheet. This is something that can be given out to employees, and it explains menopause, what it is, how it can impact women. Because again, I have women coming to me at the Mayo Clinic who have this whole host of symptoms: hot flashes, night sweats, I'm gaining weight, I'm waking up in the middle of the night, my heart's pounding, I'm losing hair. It's all very scary sounding. And it doesn't all sound like it would fit together. And many women come not to see me as a menopause expert, but to see me as an internist at the Mayo Clinic, saying, I don't understand what's happening to me. So if women don't know what's happening to them, you can imagine that employers don't either. So this is going to require education for everyone. All right, so future directions. This is me with my researcher hat on, but what I think we need to look at, what is the impact of women who sort of just opt out, who sort of exist in the workforce without really quitting, but are really just not living up to their full level of performance? So I also think there's a significant impact on the leadership pipeline. And I think this is one of the reasons why there's a deficit of women in the C-suite. Keep in mind, women who are most senior in the company are hitting menopause right at the same time. And think about, you get that offer, and I've had women in my office telling me this: I got an offer for the next job, I just don't think I can do it right now, and I turned it down. I had the CMO, Chief Medical Officer of a major global conglomerate, come to me and said, I think I'm going to have to step down from my job. And she said, I said, why? And she said, these menopause symptoms, I can't do it. And that was a doctor coming to me saying she couldn't do her job because of these symptoms. So imagine what everybody else is coping with when they don't know what it is and they don't know who to go to for help. That woman had access to me. We still don't know the impact of the intersectionality of race, socioeconomic status, education, age, and all these other factors that also play in. So the tricky part about menopause is we're not the age of reproduction. We're not the age of pregnancy. So it's corresponding with this time where women feel like they may be aging out. So there's intersection between going through menopause and aging, and the discrimination related to both of them together can be magnified. We don't know the work experiences of LGBTQI individuals, and then the assessment of the impact of interventions in the workplace with assessment of work outcomes is still in its nascency. So there's been a total, I think, of like 6 studies so far that have looked at giving education to women in the workplace, or looked at interventions like yoga in the workplace, but really none of them are looking at work outcomes, work productivity, worker satisfaction. I mean, all of those things that can be measured, we need to be looking at in terms of the interventions that we try. So in conclusion, menopause symptoms can adversely impact women in the workplace. The work environment, also bidirectional relationship, can adversely impact women's experience of menopause. We know that women are a vital part of the global workforce and economy. The costs to everyone are staggering, and there's a critical need to improve the medical treatment provided to women with menopause symptoms, and a real opportunity to make the workplace environment more supportive for women going through what is a universal life stage. Everybody's going to experience it. So with that, I am going to exit and stop sharing. And I would be delighted to answer questions.
Thank you, Dr. Faubion. I hope you can see the webinar chat, because 2 things jump out at me. One is, I think if we were in real life, you and the Menopause Society would be getting a standing ovation right now, because there is clearly a large group of folks on who feel seen. So thank you very much for that.
Sorry, I'm trying to start my camera again. I don't know why it's off. Let me see if I can start it. Stop video, start video. I don't know what happened. It was on earlier today. Apologies, but you keep going and I will be happy to answer questions.
I think the second thing that really jumps out at me is all of the questions and the mutual support that's going on over here. So one, everybody who's participating in the chat, thank you, because that's just amazing. One of the questions that came early on, is there any research on how stress affects the symptoms? And I think I would tack on to that workplace stress in particular.
Fantastic question, and apologies, guys. I don't know why the camera's not working. It was working earlier. So yes, stress makes everything menopause symptom worse, 100%. We don't know if work stress is any different than any other stress, and it's really hard to untie those 2 things. So it's hard to untie personal stress from work stress, but we know that oh, it says, please close all browsers and rejoin the meeting. I'm not going to do that. I guess we can just do without the video for now. So we know that anxiety worsens menopause symptoms too. And so sometimes working on those symptoms of feeling stressed, those symptoms of being anxious, can help with menopause symptoms. And to that end, we know that cognitive behavioral therapy is an actual treatment for menopause symptoms. So that's reframing it. So in other words, if I get in a boardroom and I start giving a talk and I'm like, oh my God, I'm getting a hot flash, it's getting worse, it's going to be so embarrassing. People can see me sweating, they can see my armpit stains, it's going to be terrible. The more I worry about it, the worse it will make my symptoms. And so if we can stop that, your head going into the catastrophe mode, like we call it catastrophizing. So if we can stop that right at the beginning, it can actually make menopause symptoms worse. So cognitive behavioral therapy is used as an accepted treatment for management of menopause symptoms. It may make you it may make the hot flashes better. It's not going to make you not have them to begin with.
Thank you. One of the other questions that came up, are women owned or women run workplaces? doing anything different? Are they doing better? Are they more responsive to menopause, or is there really not a difference yet?
I don't think we have that data yet to say that women-run businesses are handling this better. And I can't really say, we've gotten even leading, it's been amazing the interest in this employer program that we've got going. And even before we have started the designation program, there's over 100 companies that contacted us that say, we want in. And I can't tell you just off the top if there are more women-owned or women-run companies in there, but that's an excellent question.
Thank you. This one may be tough to answer, but the executive orders that we've all seen of late, have you heard or noticed anything different in terms of any reluctance or eagerness to talk about menopause in the workplace?
Oh, that's so interesting. I think it's too new, but uh, actually, no. I think I have had, my experience has been more women are more willing to speak out. More now than ever. And we've had people coming forth to my institution, to the Menopause Society, saying, how can we get involved? How can we help? And I don't know if that's a direct impact of these executive orders, but I do think women are somewhat activated because of what's going on. And I love to see that.
Do you feel, and I just saw this question come up, is there any concern about the availability of funds for research into this right now, given, again, some of the executive orders that are coming through?
Yes. Yes, in a big way. And so I was supposed to be at the National Institute of Aging last week, speaking at a conference on reproductive aging, and the whole conference got canceled. So it was flat out just canceled. So they're trying to reschedule it for later in the year. The Office for Research on Women's Health, which is a federally run office, that was pulled down entirely. The website was pulled down, and it has come back up again. But even the people who run it got us on a phone call. There were about 20 of us on a phone call, and they said, can you look at our website? Has anything changed? We don't even know what was changed. So it's a little bit of a chaotic time right now. But my hope is that we're going to get up and running again, and things are going to continue to move forward. And, maybe a step backwards, but hopefully we're going to take 3 steps forward in the process.
Thank you. We got a question about hormone replacement therapy. Do you have any opinion on that that you'd share?
Yeah. And just a quick note, we don't call it replacement therapy anymore. And I think this is an important distinction. We call it hormone therapy or menopausal hormone therapy because it's key here. We are not trying to replace what the ovary used to make. We are just trying to manage symptoms. We are not trying to make you into a 20-year-old again. So hormone therapy, yes, very effective. It is the most effective treatment for menopause symptoms. It's dramatically underused right now, and a lot of it has to do with misconceptions about safety. We've had a lot of data come through since the big scary trial, the Women's Health Initiative, that largely made women stop using hormone therapy. There was a lot of sensationalism around the reporting of the results that scared women and, frankly, doctors about hormone therapy. But we've come to understand over the last 20 years that for those women who are within 10 years of menopause onset and who start it when they're under the age of 60, that the benefits most often outweigh the risks. So it's being underused. Many more women should be using it than are. There are some contraindications to its use, including a history of a heart attack, a stroke, a history of a breast cancer. Those are a history of a blood clot. Those are reasons that women would probably try something else. But that doesn't include a whole lot of women. And so most women aren't going to have those contraindications and can probably consider it if they have bothersome symptoms.
Is there an intersection between deep vein thrombosis incidence and hormone therapy?
So there's a relationship between estrogen given by mouth. So that could be an oral contraceptive pill, increased risk of blood clot. And if postmenopausal hormone therapy, which incidentally is 1/4 to 1/5 the dose of a birth control pill, it's a much lower dose therapy than a birth control pill. If it's given by mouth, still has an increased risk of clot. But for that reason, we often give it through the skin as a patch or a spray or a gel. And we think the clot risk goes away when you give it through the skin. There does not seem to be the same clot risk because it doesn't have to go through the liver to get digested. It's the liver that produces blood clot proteins when you digest something, and you hit the liver when you go by mouth, but not through the skin.
Got it. And I'm blending a couple of questions here, so forgive me if I get this wrong, everybody. But how do we advocate for ourselves when it comes to our healthcare? So how do we make sure that our healthcare professionals are looking at menopause, looking at us in a holistic way, so that it's not, oh, you have joint pain, go see a physical therapist, or you have this symptom, go get that treated. But how do we really make sure that we're advocating for ourselves so that the whole picture is being looked at?
That's such a great question. And it's a little bit hard to coach because you can go in and say to your healthcare professional, I'm having all these symptoms. I think I'm having menopause, which is exactly what my patient yesterday did. And I looked online because I could see what her doctor told her. And her doctor said to go research some things on the internet. None of them had to do with hormone therapy. But, this was somebody who was presumably giving this woman medical advice, and all of it was wrong. So that can be challenging. So if you think you're being blown off, or you think you're not getting the answers that you think you should be getting, then I would say you need to look for help elsewhere. And where do you go? There's some reputable resources. Mayo Clinic, of course, is one, but menopause.org actually has a located provider tab, and we certify practitioners in menopause management. So it's not an easy test to pass. We only have about 75% pass rate, and we're certifying more practitioners every year now. But you can put in your zip code, or you can put in your state of residence, because some people like me, I'm licensed in multiple states, so I can see patients across state lines by video visit. But you can either look by physical location or by state licensure, and just know that your practitioner needs to be licensed in your state of residence.
Thank you. One other question I want to make sure we get to, before it flips up, but are menopause symptoms covered under HR law?
I'm sure that probably varies by state. So I'm not an attorney, but they should be covered. So if I say I'm having hot flashes and night sweats, that's a menopause symptom. But also if I'm having a depressed mood, that's a menopause symptom. So these should be covered by insurance. They should be covered by covered legally, but again, state laws vary. So there may be some different language in there, but medically they should be covered.
And I am not sure, but I wonder if the question, here, as an actual reason to take off, I wonder if part of that question is, ADA covers certain issues and you can't be discriminated. I wonder if that covers, if there's any corollary to menopause.
Yes. We did ask the labor attorney about this specifically, and although it's rare, menopause symptoms can rise to the level of a disability on occasion. Most of the time they don't, and it's important for us, as a menopause doctor, menopause is not a disability, right. And it's not a disease, and we shouldn't think about it that way. But think of it this way. It doesn't mean it's a pleasant experience, and it's a universal experience, but so is death. So, and childbirth isn't necessarily a pleasant experience. We have medications for that. So there's something that can be done to make it easier, but it's not a disease, and we need to keep that in mind.
Right. I think we have time for one quick question. So I think there's a number of questions here about what's the distinction between the phases? How do you know if you're in peri versus post versus right in the middle of menopause?
Yeah, that's a great question. So perimenopause, you know, if you think about it, anything after the age of 45 is considered normal for menopause age. Mean age is 52 in the United States. About 95% of us have gone through by 55. So if you say perimenopause can start 6 to 10 years before menopause, then if 45 is normal, you back it up to 35 and you say women in their 30s could very well be experiencing perimenopause symptoms. The actual definition has to do with both hormone levels and skipping periods. So if you're 45 years of age and you're starting to have a period or a cycle 1 month that's 30 days and the next month it's 40 days and the next month it's 21 days, that could be perimenopause. But if you're the same woman and you're 30 years old, I would say we need to look at some other things before we call this perimenopause, right? If you're postmenopausal when you've had no period for 1 year, and you will remain postmenopausal for the rest of your life. So we typically, and premenopausal is all the time before that when you're in your reproductive years. So that's premenopause. Perimenopause is this vague time in between where you might be skipping periods, but you haven't gone a full year without no period. Menopause is no period for a year or more. And I see I'm 58 and I'm going crazy. Get some help. Menopause.org.
Yeah, thank you so much, Christine and Dr. Stephanie. Really appreciate this. This is really great, and I hope that the people that joined us today got something out of it. And we are going to adjourn here at 12:43 and give you 2 minutes back in your day. Thank you, everybody, for joining us today, and have a great rest of your day.
Thank you all. Sorry for the video glitch.